बहुत रिसेंटली हमें ये सब चीजें सुनने में आई. आई डोंट थिंक व्हेन वी वर यंग वी एवर हर्ड अबाउट PCOS PCOD. A very warm welcome to Nature Fit's podcast series. Today we are here to talk about a very interesting terminology that we have been hearing nowadays, which is PCOS and PCOD. बहुत रिसेंटली हमें ये सब चीजें सुनने में आई. आई डोंट थिंक व्हेन वी वर यंग वी एवर हर्ड अबाउट PCOS PCOD, बट अब तो ऐसा है कि व्हाट वी हैव फाउंड आउट दैट the entire world, it's almost 13% of females are affected by PCOS and PCOD. And today we are here with our expert guest to talk about PCOS and PCOD. A very warm welcome to Dr. Gaurangi Karmakar. We are thrilled to have you, ma'am. She's an MD Ayurveda with over 23 years of experience in Ayurvedic and Panchakarma treatments. She is the founder of Tejasvi Ayurveda and Panchakarma Clinic and serves as director at Tejasvi Medinova and Divocare Private Limited. Ma'am is recognized for her research on diabetes and hypertension management through Ayurveda and has been featured in the media on platforms like ZTV and the Times of India. Among her several accomplishments, she has been awarded the Navarashtra Women Achievers Award, the Dhanvantri Award 22, Ayush Global Award 2023. And ma'am's specialization is in reversal of lifestyle disorders, mainly diabetes, PCOS, PCOD, also into infertility. A very warm welcome, ma'am, today. And ma'am, today here we are to talk about PCOS, PCOD. Again, as I said, कभी हमने सुना भी नहीं था पहले इन चीजों के बारे में. Now, girls as young as 13, 14, 15 are getting this disease. So let us try to, get into know more about PCOS and PCOD and also understand the approach which Ayurveda takes towards it. So just to understand, ma'am, like nowadays, again, as I was saying, कि PCOD is बहुत prevalent है. We've heard that many different pathies are addressing PCOD in a very different way. So I want to ask you, what is PCOD as per Ayurveda?
Okay, see, many diseases have been eradicated and many diseases are upcoming. So, unlike other pathies, Ayurveda is not based on the concept that is drug and disease, but Ayurveda is based on the concept of certain principles. That means if Vata, Pitta and Kapha, these are the three governing forces. If they are in equilibrium, then the person is healthy. If this equilibrium disrupts, then the patient is suffering from any kind of different ailments. So in PCOD also, we are seeing the balance of Vata, Pitta, Kapha, which is getting disrupted. That is the most important thing when we see it in Ayurveda. So removing of the exorbitant Pitta and Kapha from the body, and that is how we are reversing the PCOD and PCOS. And the most important factor about PCOD is that it has been mentioned in our classics under the name of Yoni Vyapat. Only the thing is that the names are in Sanskrit, and nowadays as we are the Ayurvedic doctors, we have to correlate it and we have to present it in an integrated way.
Right. So, that's what we understand, that Ayurveda, the major principle, जैसे आपने बताया, is to identify the imbalance in the body, which of the doshas. So it works in a very different way than the other pathies, I believe. So, ma'am, like PCOS and PCOD, जब भी सुनते हैं दोनों का नाम साथ में ही आता है. What is the difference between PCOS and PCOD?
See, when we see it apparently, PCOD seems to come under gynecology, but basically it is a disease of metabolic syndrome, metabolic disorder and endocrinological disorder. So when the hormonal imbalance is very little, it is called PCOD, that is Polycystic Ovarian Disease. But when the metabolic disorder is metabolic toxins, they are very high, or there is a lot of endocrinological disturbances, then that condition is called Polycystic Ovarian Syndrome. So this is the difference between PCOD and PCOS.
And ma'am, intensity wise, like when somebody has PCOS or PCOD, किसकी intensity ज़्यादा है और
Of course PCOS, because PCOD is really very it is a beginning. It is the beginning. It is the very initial stage of that disease, and if a patient approach to any Ayurvedic doctor at very initial stages, then it will be reversed very easily. That will, the disease will not progress to PCOS.
Right. So what are the main symptoms that we can see in a female for PCOD?
Okay, see, when the girl gets her first menarche, that means the first menstrual cycle. So initially those menstrual cycles are irregular, and that is the normal thing, that is the physiological thing. But after a few months, the cycles become regular. Okay, and in case of PCOD, what happens? Generally, what happens? Every month the girl gets menses. So in 12 months she will get 12 menses. Okay, every month she will get that menses. But in PCOD, the girl gets 7 to 8 times of menses in the whole year. That means in 12 months she will get 7 to 8 times menses. Okay, these girls may develop a facial hair and acne on their face. These girls generally they are obese. These girls develop dark velvety patch on the neck of the neck, in underarms, in the inner aspect of thighs. These are called acanthosis nigricans. Okay, and these girls may suffer from depression. So not all the time each and every woman or female will show all these symptoms. But if a patient if the patient finds that she is having few of the symptoms, she has to approach an Ayurvedic doctor, and definitely the doctor will advise them some blood tests and sonography, and will confirm the diagnosis.
Right. Again, what are the major changes, like you've given a few symptoms in the female body?
Mm-hmm.
So what are the major changes that they can see other than just these apparent symptoms?
Okay. See, first of all, I would like to tell what is actually menstrual cycle, what happens during the menstrual cycle. See, women, they are having hypothalamus and pituitary gland in their brain, and they are having remote control, and they are releasing certain hormones. Under that hormone, under the influence of that hormones, it acts on the ovaries, and ovaries release some hormones, and because of that, what happens? Follicles start maturing, and the internal lining of the uterus, it starts growing, which is called endometrium. So when the follicle matures completely, it bursts and it releases the egg, that is the ovum. And at that time, if the couple keeps physical relationship, and that time the women, the female, she get conceived. But if this doesn't happen, then what will happen? This internal lining of the endometrium, it gets shed off in the form of menses. So this is the normal menstrual cycle. So if the female, she is consuming fast food, junk food, or she is having bad lifestyle, like staying awake late in the night, waking up very late in the morning, and lack of exercise. So this builds insulin resistance in those women, and she becomes obese. And after that, the ovaries start producing the hormone which is called androgen, and that is the male hormone. And that male hormone androgen, they causes facial hair and acne in that girl. And what happens? The follicle, as I had told you earlier, that the ovaries release male hormones, that is the androgen, and the follicle is not maturing. That is why it is not releasing the egg, and that is the cause of infertility in PCOS women. So these are the effects. These are the things which happens in the women who are having PCOD or PCOS.
Right. And is it like now we're also hearing a lot about infertility, like every other woman is facing problem to conceive naturally, which was never a problem before.
Right.
So what do you feel that women who have infertility, okay, PCOS or PCOD could be the root cause for it, but is IVF only the option to go for?
No, PCOD, these women can conceive naturally. As I told you earlier, that if the hormonal imbalance is in very little amount, then definitely they can conceive easily and naturally. But a hormonal imbalance, if it is exorbitant, and if it is the case of Polycystic Ovarian Syndrome, then definitely she has to go for IVF. but the patient visits Ayurvedic doctors only then they are having they never get success in that IVF treatment. And we Ayurvedic doctor, we give them panchakarma therapies along with our Ayurvedic medications. So we remove the insulin resistance from their body, we give correction to all kind of hormonal imbalances, and the female conceives naturally.
Great. So I think for a lot of the women who are going through, the pain of IVF, IUF, I think this is a very good takeaway that Ayurveda and the overall holistic change in their lifestyle and diet can actually help them to conceive in a natural way. Now I think the most important question, that how is Ayurveda and the entire holistic approach that Ayurveda takes helps in the reversing?
See, as I told you earlier, that this is not merely this PCOD doesn't come merely under gynecology, but it is a metabolic syndrome. It is endocrinological disorder. So when patient approach us, at the time what we are doing, we give them the test fasting insulin, which indicates the insulin resistance in their body. And after permanent duration panchakarma therapy, we repeat that fasting insulin, and it shows significant reduction in that fasting insulin level. So we give correction to that the basic root cause, and after that we give correction to the hormonal imbalances by giving Nasya and Basti therapy. See, what is Nasya? Some medicines, they are instilled into the nose. As Ayurveda says, nose is the gateway to brain. So whatever the medicine instilled in nose, it reaches to brain, okay, and it corrects the hypothalamus pituitary ovarian axis, and that is how it works very nicely. And another thing is that Basti looks like enema, but the action is totally different. Enema is different and Basti is different. So Ayurveda says whatever the medicines we are instilling in intestine, it reaches to brain through receptors. And nowadays you might be knowing that everybody is saying gut is brain. Our intestine is having 100 millions of neurons, that is the nerve cells. So whatever the medicines we instill into the intestine, it reaches to brain through the receptors. So we give correction to again hypothalamus pituitary ovarian axis, and this is how the insulin resistance gets removed, the hormonal imbalances comes into equilibrium. Now coming towards Ayurvedic medicines, what happens in PCOD? There are fluid-filled cysts in ovaries. So Ayurveda believes in 5-element medicine system, that is called Panchabhutik Chikitsa. So in PCOD, what happens? Follicle doesn't get mature and they accumulate in the ovaries in the form of fluid, that is the fluid-filled cyst. So we use fire element, that is Agni Mahabhut Chikitsa. So we use fire element medicines. So after using those medicines, we repeat sonography. So sonography shows absolutely normal ovaries. So this is the most important thing. And another important thing I would like to share with you, that our ovaries produce androgen, which is the male hormone, and in our liver there is a hormone called sex hormone binding globulin protein. So what is the function of that sex hormone binding globulin protein? That male hormone binds with that sex hormone binding globulin protein, and this is how it is working in the body. What happens in PCOD, that sex hormone binding globulin gets reduced, and that is why the male hormone becomes active and it gives facial hair and acne to that female. Okay, now Ayurvedic medicines, they are very, many Ayurvedic medicines, they are having a very nice effect on liver. So we are using those medicines which increases sex hormone binding globulin protein, and that is how the male hormone binds with that sex hormone binding globulin, and the patient, that is the lady patient, she gets rid of from the facial hair and acne. So I always advise my patients that it is not a case that facial acne or the facial hair, it is not a case or under cosmetology. It is not the case under that you will reach to any salon and you will get all the salon treatments done. So this is not like this. This absolutely required medicines. Okay.
Thank you so much. That was a very insightful, explanation ki why is that particular symptom coming? Why is the facial hair coming? We just look at the symptom, but the way you explain, it's very scientifically explained. And now I think the most important thing which we want all, right from teenagers to college-going girls to young would-be mothers, that what is that they can do so that they never get PCOD or PCOS.
Okay, this is really very important question.
Yes.
See, first of all, I always advise my patients to have homemade food. So if you are thinking I'm having homemade pizza, homemade pasta, so it is really not advisable. You have to consume healthy, homemade, fresh and traditional food. Okay, so this is how you will not build up insulin resistance. And they have to sleep at right time at night, because what happens if you will stay awake late in the night, then it will increase cortisol levels, and increase in cortisol levels will increase male hormones in the female body. So that is how we have to keep our cortisol hormones in normal limits. So that is why we should sleep at right time. And I always advise all my patients, whether they are obese or they are lean, to exercise. Most of the times what happens, nowadays lean patients, they also develop PCOD in them. See, we call lean patients toffee. This is the medical terminology. What is toffee? Thin outside, fat inside. So if you see obese women, they are having subcutaneous fat. But if you see lean women, they are having visceral fat inside. So whether you are obese, whether you are lean, nothing doing, you have to exercise. So homemade fresh food and right lifestyle and the exercise. This is the key to prevent PCOD.
So I think that is the mantra which you have given. It's actually a magic, and the best thing about this mantra is कि अगर हम ये मंत्र follow करेंगे तो हमें PCOS, PCOD ही नहीं, हमें कोई और बीमारी भी नहीं होगी. So I think, see, I was reading somewhere that there are two types of suffering. Either one suffering where you sleep on time, eat only home food, you exercise daily, or there is a second suffering where you have to be in the hospital. So you decide what is the suffering you want for yourself. So thank you so much, Dr. Gaurangi. It was, I think, a wonderful, kind and insightful, with completely, I would say, scientific way of explaining what is happening in our body, what are the symptoms, why they happen, how Ayurveda works, and what is that we can do to prevent this disease. So thank you so much. Thank you for being with us. It was so wonderful having you. Thank you, ma'am.
Thank you.